Hi, I'm Julie Donnelly. I've developed the unique Julstro techniques to be a self-treatment system to release the muscle spasms caused by repetitive strain injuries. Through my years as being a muscular therapist, I've run into many people who are suffering from TMJ. Today's session in Pain-Free Living is to cover why muscles will cause, it's called temporomandibular joint, TMJ, jaw pain, and even into your ear. The muscle that causes this TMJ problem, temporomandibular joint problem, is called the masseter. The masseter muscle originates all the way up here on your cheekbone and comes down and inserts here on your jawbone. If you put your fingers like this and then clench your teeth hard, you'll feel the muscle pop out. It's the muscle that you use to chew your food. So obviously you're using this muscle a million times every day. It gets tight, and the only way to stretch that muscle is to yawn, or to open your mouth really far. But we don't do that very frequently. The muscle keeps getting shorter and shorter and shorter. And if you're having Tmj pain, which is all here, goes into your ear, into the side of your jaw over here, even down in this way, what you're going to do is you're going to feel like your whole jaw is flipping over to one side, to the tight side. If you go like this, you're going to feel bumps in the cheekbone, in the masseter muscle. Those are the knots that are causing the muscle to be shorter. So think about it. If the muscle is here, and when you bite down, it shortens, so it'll come to here. And it's doing this over and over and over again, and the knot forms right here. All you need to do is put your fingers on it and hold it. If this side, for example, the left side, is tighter than the right side, when you try to open your mouth, your jaw is going to move over toward the left side, and you're going to hear the bones and feel the bones as they flip over each other. The masseter muscle is also not just for TMJ. At one point, I was working in a doctor's office, and a woman had come in who was going to be getting some oral surgery done the next day, and she was actually having the masseter muscle, both sides were going to be severed because they were so tight that she couldn't open her mouth. And she needed to have medical clearance in order to be able to have this surgery done. She was terrified. She was in her early 30s. It meant that her mouth was now going to be drooped open for the remainder of her life, and you know that means that she's going to drool. When she saw the doctor, I had been working there for a long time, and he believed in everything that I did. And he said, I'm not signing anything until you see Julie first. So she came and she saw me, and I was there, and she came back to my office. And I taught her how to do the treatment for the masseter muscle. It took maybe 15 minutes. At the end of the 15 minutes, I had her pressing on both sides, and then I said, okay, now I want you to press hard and open your mouth wide. And she did. And then I had her take her hands away. I said, okay, now open your mouth. And she did. And she burst out crying because it took 15 minutes to get rid of that tension, and she would have spent the rest of her life with her mouth open. It's so important to learn how to treat the muscles and the things that muscles can do. Don't overlook them. It's so important. For more information, go to my website below, julstro.com. I also teach clinics, Julstro clinics, all over the country. I hope to meet you one day at a Julstro Self-Treatment clinic. Thank you.